The things we owe can end up owing us. When possession becomes overwhelming, it is not just about cluttering, but a deep emotional struggle. Hello everyone, I am Mansi, counseling psychologist at TalktoAngel. Welcome to our channel, series on clinical disorder, episode number 6, Hoarding Disorder. We have Dr. R.K. Suri, a clinical psychologist, to talk about hoarding disorder. So sir, what is exactly hoarding disorder?
Thank you, Mansi. Hoarding disorder could be categorized or diagnosed as a persistent difficulty or discarding or parting ways with possession of any value. Now, let's understand what are the signs and symptoms of the hoarding disorder. Typically, there is a cluttering of the things or items which a person try to accumulate, considering that would be of a great help and value to them. And on account of excessive possession, the person often hold them and try to even sleep with them. The hoarding disorder itself could be a disease which has been diagnosed as per the DSM.
This is very insightful to know about details of hoarding disorder. I want to ask, what is the difference between hoarding disorder with collection and OCD?
Collection of items or possessing them is not a problem, it is a normal behavior. We all collect items. So, for example, clothes, we all collect shoes, we all collect stamps. But if we find that they are of not valuable to us, we then discard and then we part ways with them. Now, when you have a difficulty of parting ways with any of the items which is of any value, then it is a concern and it is called as hoarding disorder. Whereas if it is of any value to you and you think that it is going to be valuable and it is not becoming overwhelming to you, then it is a collection. And now question comes OCD. OCD is obsessive compulsive disorder, and if it is an obsessive compulsive disorder for hoarding, then you have an intense intrusive thoughts of collecting certain items or products or even the sentiments you try to own them and hold them, and then you get a difficulty to discard and part ways.
Thank you so much, sir, to explain this difference in so simple language. And if I talk about what are the possible treatment and therapies for hoarding disorder?
Okay, let me first describe you what are the reasons for hoarding disorder. One of the reasons is biological reasons on account of the brain functionality. The other is a learned behavior from the childhood, that your mother has been collecting something, your father has been collecting something, and then you become obsessed in terms of collecting certain items and keep them for your use. But that doesn't become the hoarding disorder. When you find that it is of no major value but you still hold it, then it is a concern. Now, the other reasons is of hoarding disorder could be anxiety, could be depression, could be a schizophrenia. Now, we need to differentiate between them and understand the reasons or etiology of hoarding disorder, and then we are in a position to treat it. Now, if it is a learning issue, then cognitive behavioral therapy is of a great immense. Group therapy, family therapy, because it is impacting the whole family. It is impacting the relationship. Problem solving needs to be taken up and have a discussion with the family member and identify what is required and what is not required. And maybe logically one can come up with the practice of having a defined policy of removing the clutter. For example, in the banking sector, you need to keep the proofs and records up to 7 years. After 7 years, the records of the people needs to be discarded, which are not on non-operative bank accounts and non-operative people's. So all documents, there are different kind of policies which are there in the corporate world for parting ways of the items which are not relevant and useful. That's what we call as cleaning the clutter. Now, this would be logically good for. If all of these are not helping and there are biological issues and challenges, then we need to give certain medication.
Thank you so much, sir, for the inspirational and insightful session on hoarding disorder.
Mansi, I would like to put across that today for overcoming hoarding disorder, we have a platform called TalktoAngel, wherein more than 750 psychologists, psychiatrists are available to provide help to overcome hoarding behavior. Take session, online counseling session if anyone of you is having a hoarding disorder or hoarding issues, concerns at TalktoAngel.
Thank you so much, sir.
Thank you very much.
See you in the next episode.